All right, we're just going to give it a minute or two here so that folks can sign in. Feel like I should give like a weather report. We are live now from Annapolis, Maryland, and we are welcoming those who are hopping on from really different parts around the country, which is always fun. And some of the folks are already working with Blue Heron Financial Group, and others have come to know us over the years through our affiliation with Northrop Grumman through the credit union. So while they're still registering or jumping on here, I do want to just thank Northrop Grumman Federal Credit Union for our 23-year partnership, which always just amazes me. And we're happy today to be bringing some education, which is very timely. My name is Margie Cosmerl. I'm guessing I'm a pretty familiar face to many of you. The company name Blue Heron Financial Group. And in just a couple minutes here, I'm going to turn it over to Emily. So as we're getting started, and before we get into the real meat and potatoes of Medicare, I have had the pleasure to meet Emily and also John, who you will see on here, through clients who were looking for assistance through just the multitude of information on Medicare, and had received such positive responses back from our clients. I invited them as the experts in the field to see if they can provide education to all of you today. So I'm delighted that we're able to have this relationship. And again, I'm going to turn it over to Emily, but just a little background on Emily's career. She has been working with individuals, couples, and groups, navigating the Medicare landscape, avoiding common mistakes and problems that can derail a Medicare member's experience. She's a licensed Medicare insurance agent and has a passion about elevating her clients' understanding of Medicare. She's helped hundreds of Medicare beneficiaries achieve success with the Medicare enrollment and plan selection process, and remains available to them as they continue their Medicare journey. I like that. I always talk about financial journeys. It is a journey. So in addition to Maryland, she is licensed in 15 additional states as along with District of Columbia. So without further ado, I'll turn it over to you, Emily, as the expert in the field. And again, thank you so much for your time today.
Oh, my pleasure. Thank you so much for having us. We're really excited to present today. So we're here today to talk about Medicare basics, and we're going to cover a lot of ground. This is my 5th year that I will be working with seniors, as Margie said, on navigating the Medicare journey. And as she mentioned, this is a passion of mine, and I enjoy what I do so much that 2 of my kids are now on our team as well. So my son on the right has joined our team as an agent not quite 3 years ago. He's based in, that's Riley, based in Charlotte, North Carolina. And my daughter on the right is a customer support intern now. So we have a family affair here at MP Group now. So we'll tell you a little bit more about that. Also with us today is the founder and president of our company, and the person who really inspired me to get involved in this work, and that is John Norse. John, would you like to say a couple of words about who we are and just really what our focus is?
Sure. Thanks, Emily. Good morning, everyone. Sorry, I'm a little congested, but anyway, what we are is we're an independent insurance agent. We are certified by Medicare because Emily, myself, and our team has to pass certifications every year to remain compliant in our industry. We also are required to be compliant with our states that we operate in as an insurance agent. We also are compliant to pass certifications with each insurance company that we work with. So we are heavily, policed, but we don't mind it because we love what we do. We focus on education, enrollment, and lifetime support. So we're not interested in just helping you today, but if you were interested in engaging our services in a long-term relationship, we're interested in helping you not just transition into Medicare, but everyone knows there's an annual enrollment, helping you manage that as well as life events through the rest of your life. Emily will do a great job today, so I'll duck out here, and thanks for joining us.
Well, John is the person who can make Medicare fun, if that is possible. So John, you need to jump in and throw in the tidbits here and there. So just we do have a handy acronym to help remember how we work with our clients. So we are here to help you prepare for Medicare, specifically through education. As John said, that's the key to a successful Medicare experience. To walk through the application process, there's a lot involved, a lot of pitfalls, and that is where we think we offer a lot of value in that step of the way. Teaching Medicare members how their benefits work and how to have the best experience with their coverage is the third step. And then help, like John said, and like Margie mentioned, this is a journey, it's ongoing, and we're here to support our clients. So PATH is what we do. All right, this is our current coverage area. We are, again, based in Tysons Corner, Virginia, but we do have agents that cover the states that you see here on the screen. And for more information, you can reach out to us individually. So you're probably here today because you are either one of the 10,000 Americans turning 65 each day, or you're close to someone, or you're about to be there really soon. You may have joined us because you're enrolled in Medicare and want to just have a refresher and just be reminded how the Medicare program works, or maybe there's some things that are still confusing after having been enrolled for a while. So whatever has brought you here today, you're not alone. Obviously, this is a big population in the United States, and John, I will just brag on him, after decades in health insurance, had the vision that Medicare was an area where people really needed help understanding how this works. So it's new to most people when they get to it, and we want to make sure that you really understand how it all comes together. So to do that, what we're going to cover today is literally defining what is Medicare and then who is eligible. We're going to talk about what your options are, generally speaking. So we won't go into any plan specifics, but we're going to talk about the main types of coverage that you can have. We're going to talk about when you enroll based on your unique circumstances. We're going to talk about what some of the base costs are, or the sort of universal costs or types of costs involved with Medicare. And we're going to talk about what help is available after today to just really be ahead of the game and on top of everything Medicare related. So first, what is Medicare? Well, it's unclear to a lot of people. And again, a lot of people aren't really paying attention until they get to it. So Medicare is a federal program. It does fall under Social Security. So CMS is under the Social Security Administration, and your enrollment into Medicare is processed by Social Security. Your eligibility for Medicare is determined by the Social Security Administration. So Medicare is a program that offers health insurance to American seniors and other eligible individuals, and we'll talk about who those people are. So it was created in 1965, took effect in 1966, and it started with what is called Original Medicare, which we will go into detail in just a moment on. So Original Medicare, which you sometimes will see abbreviated as OM, has two parts, parts A and B. Later on, Part C was added 1997 and Part D in 2006. So we will talk about each of these four parts of Medicare. Remember, Original Medicare is just referring to Part A and Part B. Now, sometimes we'll have folks who will confuse Medicaid with Medicare. Medicaid is a federal state partnership that supports lower income citizens and residents of the United States. It is also available to some people who have Medicare. So you may have someone who's a Medicare member and also eligible for Medicaid, but they are different programs. Medicare is for everyone who qualifies, so it is not tied to an income the way Medicaid is. So who is eligible? Well, we mentioned U.S. citizens and legal residents. And as a legal resident, that resident must live in the United States for at least 5 years in a row, including the 5 years just before applying for Medicare. Then you must also meet one of the following requirements: being 65 or older, or under 65 with a qualifying disability. Also, at any age with a diagnosis of end-stage renal disease or ALS, Lou Gehrig's disease, you will qualify for Medicare. So this is really what people are usually the most interested in as they approach Medicare eligibility, or even annually while you're enrolled in Medicare. Let's talk about what your options are for Medicare coverage. So first, it's important to understand the structure of your options. What is built upon which part of Medicare, which plans, how do they all fit together like a puzzle? Well, first, it's important to understand what the foundation of every option is, and that's going to be original Medicare. So this is the oldest piece, the first piece. This is the federal government piece, and it has two parts. Part A, which is called hospital coverage, typically has no monthly cost, and that is based on a 10-year or 40-quarter tax-paying work history. It's possible to purchase Part A if the individual does not have a qualifying work history. And if that is something that might apply to your situation, you can reach out to us offline and we'll give you more information about that. Most people will not have a monthly premium for Part A. Part A, again, as hospital coverage, is going to cover your inpatient care. So inpatient hospital stays, skilled nursing care, hospice, and home care. So you can see on the screen, these are the 2023 Part A hospital deductible and daily copays for skilled nursing care. So these would be amounts that would be the Medicare members' responsibility for Part A coverage. Now, Part B is referred to as medical coverage, which I always think is funny because if I'm in the hospital, that's pretty medical. So we usually tell our clients to think of Part A as inpatient and Part B as outpatient, just to make that distinction more clear. Now, Part A does have a base premium. This year, that premium is $164.90 per month. Most people will pay that base premium, but there are people who will pay more for Part B based on income, and we'll talk about that later towards the end of the presentation. Individuals that qualify for Medicaid in addition to Medicare will have help towards their Part B premium. Part B, again, that's the outpatient side of original Medicare. That's going to cover office visits with primary care and specialists. It's going to cover outpatient surgery, lab tests, radiology, durable medical equipment, preventive exams, and other outpatient types of claims. So there is an annual deductible. You'll see there this year, that is $226. And then after the deductible is met, the eligible Part B claims are paid by Medicare at 80%, and they would be left to the Medicare member to pay 20%. Now that 20% right there is one of the most potentially catastrophic items. There is no annual out-of-pocket maximum with original Medicare, nor a lifetime maximum. And we've all seen that explanation of benefits from health insurance where we've seen what the total cost of a surgery was before it was adjusted and the insurance paid. So you know what some of those numbers can look like, and it certainly isn't something that most of us would want to be responsible for paying 20% of. So with these unlimited out-of-pocket expenses with original Medicare comes the need for additional insurance. And this is where all of the private insurance options begin, or coverage options that are going to be offered by private insurance companies. So let's talk about those. So the first option is going to be to keep original Medicare as your primary insurance and to add a Medicare supplement, also known as a Medigap plan. These are the plans with plan letter names like Plan A through N. They're standardized across Medicare. And that means that whichever insurance company you have your Medicare supplement from, the coverage will be the same from one Plan G, for example, to another. What these plans will do is they will, according to their benefits structure, which is defined by the plan type, they will pay some of that Medicare members' out-of-pocket expenses that are left after A and B pay. Again, this is secondary coverage after A and B, so your primary coverage is Medicare. With these plans, you would then need to add, or most likely want to add, a Medicare Part D plan, which will be a standalone prescription drug plan. So Part D is going to be your prescription drug coverage. And this option for your Medicare coverage, it will be a standalone plan because A and B did not cover prescription drugs when Medicare began. So this is like an a la carte piece, an add-on separate from your supplement. That was one of the questions that I saw that was sent in advance. When you have a Medicare supplement, now prescription drug coverage is separate. Decades ago, there were supplement plans that included prescription drug, but that's not the case anymore. Those have been phased out, and it is an additional plan, which, while it looks a little clunky here, can be a great thing because you can change your prescription drug plan on an annual basis without needing to change your Medicare supplement. So we'll talk more about this option, but in comparison to that, on the other side of the screen, option 2 would be to enroll in A and B, and then to enroll in a Part C or Medicare Advantage plan, which would then replace your Part A and B benefits with benefits from a private insurance company that's contracted with Medicare to cover you with the same level of coverage that original Medicare would provide. What they're also going to do is typically bundle the prescription drug coverage. There's some exceptions to that. You can reach out to us separately if you're interested in understanding more about that. But usually these plans will have prescription drug coverage built in, and they may offer some of the additional benefits that catch your eye or that you hear about. So for both options on the screen, you must have Part A and B to enroll. So the question is, wow, so that's a lot of information about both of those options. Now tell me how I decide. And this is a really customized process. So this is why we enjoy working with people as individuals or a couple to really get to know what your specific situation and needs and priorities and concerns are. What we're doing is we're trying to find the balance between your health priorities and your budget and what you have in mind for now and for the future, because we're going to talk about your present circumstance and then how that will translate the plans you select now into the future and what some of those considerations are, because we don't want you to make a decision for just right now, but to really be thinking ahead as well. So as someone who is considering these two options and trying to come up with that balance, what are some of the questions that you might ask yourself? So first of all, one of the things that you'll want to determine, and there are a few ways to do this, and we do help people with this, is whether or not your current providers participate in Original Medicare, and if they are in any of the Medicare Advantage plan networks. Those Medicare Advantage or Part C plans will have a network typically. They're usually an HMO or a PPO, and you're going to want to really focus on which providers are in network with that plan in order to continue seeing the doctors that you're happy with. So the Medicare.gov website, we'll mention it again at the end, but this is a good place to mention that that is a excellent place to determine whether or not your current providers participate in Original Medicare. So there's a plan provider search tool right there that will help with that. That was one of the questions that was submitted in advance, and it was worded as, will I still be able to see the doctors I go to now with original Medicare? You can look them up right there on the Medicare website. With determining whether or not they're participating in a Medicare Advantage plan, that would be something that you might want to work with someone to look at those specific plan details. So, of course, we're talking about health insurance. One of the most important things to think about is, what are your current health concerns? Are you actively receiving treatment for things that may be ongoing or may be particularly costly? And you want to make sure that the details related to your current health concerns will be covered well moving forward. This is something that also will translate into the conversation about cost. How frequently are you going to the doctor each year at this time is going to have some bearing perhaps on the choice that you make for your coverage. Medications are an important part, whether we're looking at a standalone prescription drug plan or prescriptions built into Medicare Advantage. We want to take a close look at what those prescriptions are, and we'll talk about that more when we get to our prescription drug section in just a moment. We will be looking at things like monthly premiums. Is it something where you are comfortable with having a higher fixed monthly premium and then potentially lower out-of-pocket costs? Would you be more comfortable with a very low fixed monthly premium and then have some variability in your out-of-pocket costs as you use healthcare, potentially up to a maximum? So that's two different ways of thinking about your spending, and one might sit better with you than the other. How comfortable you are paying out-of-pocket expenses. So that will, just sort of going into the last question, relate to that. Is it something that you are fine with doing as health concerns arise, or would you rather have more of a steady outflow when it comes to health expenses? And we mentioned how your priorities might change over time. So a lot of people are just, fortunate to be really healthy right now and not using a lot of healthcare, and you just want to put yourself in the scenario where, if that was not the case, what would you want out of your coverage? And just imagine what that looks like and use that in your decision making to help guide the choices. So to kind of address the way you might be thinking about each of those questions in a side-by-side comparison, we'll just review some of the important elements of the two main options for coverage. So under original Medicare, with adding a Medicare supplement or Medigap plan, remember that the Medigap plan is the secondary payer after Medicare A or B pay first. So to put a point on that, sometimes people will say, well, my supplement cover things Medicare doesn't cover, like my acupuncture or my homeopath. And that will not be the case. Medicare A or B have to pay first. So it has to be care that's eligible to be billed to Medicare before the supplement can do its job. So those will go together in that way. Under Medicare Advantage, the Medicare Advantage or Part C plan is paying all of the members' claims. So you're replacing Medicare A and B as the primary payer with that Medicare Advantage insurance company. Under Original Medicare, you can see any provider that accepts Medicare and no referrals are needed. Under a Medicare Advantage or Part C plan, as I mentioned, they are typically an HMO or PPO plan type with a network of providers. With a PPO, you can go out of network and see any doctor that accepts Medicare, but there may be a difference in your cost sharing amount. Referrals and prior authorization may be needed. That is all plan dependent, so it will just be something that you would want to pay close attention to when looking at a plan. For costs, monthly premiums on Medicare supplements or Medigap plans will vary depending on the plan, like the plan letter name that I mentioned, the insurance company that's offering the coverage, and where you live. Also, gender, tobacco use, and other things can come into consideration depending on your enrollment period. Also, depending on the state where you live, because there are some state-specific laws that will govern Medicare supplements. So that's all very detailed, and you can certainly reach out to us individually for more information about your specific state. On the Medicare Advantage side, We do have an annual maximum on out-of-pocket costs. There will be a maximum set by Medicare, and then plans may come in below that threshold if they'd like to offer a lower out-of-pocket maximum. So that also is something that will be plan specific. For prescription drug coverage with original Medicare, you, as I showed you earlier, will need to add a standalone prescription drug plan. But with Medicare Advantage plans, they are typically included, your prescription drug coverage. With original Medicare and a Medicare supplement, you will not have additional benefits included. But with Medicare Advantage plans, there may be some dental, vision, or hearing benefits. Enrollment into a Medicare supplement or Medigap plan versus enrolling into a Medicare Advantage or Part C plan is different. And this is an important distinction, especially this time of year. Often people will think that Medicare supplements are part of the fall annual enrollment period for Medicare. And they'll say, I'll just wait until what most people call open enrollment, but it's the annual enrollment period, and I'll change my Medicare supplement then. That's not the case. There's a very specific open enrollment period for Medicare supplements when a Medicare member first begins Medicare Part B specifically. It's a 6-month window. Outside of that window, in order to obtain a Medicare supplement, typically it would be a underwritten policy, meaning your current and recent and past health can be a consideration for whether or not the policy is issued and the rate. So it's really important to understand that Medicare supplements don't participate in that annual enrollment period where they open up to everyone. It can be a more limited circumstance for enrolling in a supplement. It's something that we like to see people just understand and be careful with. And if you have more questions about that, definitely reach out to us for clarification. On the other hand, Medicare Advantage plans are available each year during the fall annual enrollment period. So you have no underwriting ever. So people who are eligible, so they're in the service area and they have A and B, can enroll in a Medicare Advantage plan regardless of health status and will not pay more or less for their coverage. So that's something that's very different about the Advantage plans versus the Medicare supplement plans. All right, so let's get into some more specifics about Medicare Part D. So think D for prescription drugs. Now, Part D, as you've seen, we have the ability to have Part D coverage as a standalone plan with a Medicare supplement and A and B, or you could have it with just A and B or just A. Those are some less common arrangements that might apply to someone's unique situation, but typically it's A and B with a supplement and a standalone plan, or as built into a Medicare Advantage or Part C plan. And that would be called an MAPD, a Medicare Advantage prescription drug plan. So whether it's standalone or included with the Medicare Advantage, these Part D benefits will have to meet certain criteria that's assigned by Medicare. So these things that we're going to talk about are the same in either type of Part D coverage. First of all, the plans will all have a monthly premium that's going to vary by plan and slight variations by region. There's a maximum deductible that is set by CMS. It's separate from the Part A and Part B deductible. So often people will have a plan prior to Medicare where there's one deductible. Sometimes people will have a separate health and pharmacy deductible. With Medicare, this is absolutely a separate defined deductible for Part D. Now, some plans will opt to lower their deductible from the maximum that's set by Medicare, and some plans will not have a deductible. So it is all varied plan by plan. Most medications will have some copay or coinsurance, so an out-of-pocket cost. All plans will have participating mail order or retail pharmacies. Then they'll have, among those participating pharmacies, some that are identified as standard in-network pharmacies and some that are identified as their preferred in-network pharmacies. Typically, you will see lower cost sharing from the preferred pharmacies, but I have looked at enough cost search estimates to tell you that that isn't always the case. So you have to look really closely, but more commonly you will find the lower cost sharing at a preferred pharmacy. We have something called a formulary. Every Medicare Part D provider is going to have a list of covered medications for that plan. That's what the formulary is, and it is designed to meet very specific requirements from CMS. Every plan, every formulary will have a minimum of 2 medications for any ailment, any health condition that a Medicare member could have. So there's going to be something on any formulary that is considered sufficient to meet your health need. It might be something other than what you were prescribed, but there are ways to kind of address that. So within the formulary, medications are also classified by tiers. So you'll typically see tier 1 through 5. The plans determine these tiers. So that's something that is another common misconception. Someone will say, oh, I take 3 tier 4 medications. And we say, I wonder if we can figure out a plan where they're tier 3 or tier 2, because it's actually the plan that determines what tier that medication is for them. So the tiers typically do range from tier 1 as the lowest cost generics and tier 5 to the highest cost specialty medications. And to monitor all of this, all plans are subject to a star rating program. So it's a 5-star rating program with specific standards as required by CMS, and all of the plans are rated annually. And with a really low star rating, a plan is going to have to leave the service area. So definitely this is something that Medicare is watching very closely, as it should. Now we're going to get into something that is, it's a little bit challenging to wrap your head around, because typically this is going to be a different model than health insurance or prescription drug coverage you've had in the past. So we're going to talk about the 4 stages of Medicare Part D coverage. Once again, this is going to be true for Part D under a standalone plan or for your Part D coverage that's built into your Medicare Advantage plan. So this is always a calendar year coverage stage progression. So even when someone enters a plan in October or November, the coverage stages will start again on January 1st, always a calendar year. In the first coverage stage, you have the deductible. So we mentioned this before. CMS, Medicare sets the maximum deductible. And on this screen, we are looking at the 2024 finalized prescription drug coverage stages. So the amounts that you see here are not estimates. These are next year's specific cost within the Part D program. So next year's maximum deductible is going to be $545. As I mentioned, some plans will not have a deductible and some will have a lower deductible. When you're in the coverage stage, medications that are not exempt from that deductible, you will pay 100% of that plan's retail cost for the medication. So I mentioned medications that are exempt from the deductible, and that may be something like tier 1 or tiers 1 and 2, sometimes tiers 1, 2, and 3. That is all very plan specific. So it would be something that you would want to look at closely to see how your medications would be treated in the deductible stage. Once that deductible has been met, the plan member goes into the initial coverage stage. Now, in this stage, they're paying a copay, which is going to be a fixed amount, or a coinsurance, which will be a percentage of the retail cost, until the threshold, the initial coverage threshold of $5,030 has been met. Now, don't worry, that's not $5,030 out of your pocket. That's what the plan has paid for you, along with what you have paid for the medication. So it's the retail value of that medication that's been filled. Many people won't leave the initial coverage stage in a calendar year. But for those who do, the next coverage stage is going to be what is called the coverage gap, or you might know it better as the donut hole. Now, in the coverage gap or donut hole, we are now looking at 25% as the cost sharing amount for the Medicare member for generic and brand name retail drugs. It used to be as high as 50%, so this is an improvement. And to give you some perspective, you may have a medication in the initial coverage stage that might have a coinsurance of 33%, 40%. So you actually are happy with regard to that medication. When you get into the coverage gap, you go down to 25%. So it's not anymore universally a terrible place to be. And sometimes people have that misconception. It's just one of the coverage stages. It's the third one. And you'll be in this stage until the true out-of-pocket limit of $8,000 is met. And that is met by the retail cost of the medication, what you have paid, what your plan has paid, manufacturer's discount. So again, not $8,000 out of your pocket, but this is all happening behind the scenes. It's all calculated, and you can kind of track it on your login on Medicare.gov if you really drill down. The final stage is going to be your catastrophic coverage stage. This is a new development for 2024. Up to this point in catastrophic coverage, the Medicare member would have paid 5% of the retail drug cost. Starting next year, January 1st, Medicare members who do reach catastrophic coverage will no longer have any cost sharing, 0% when they get to catastrophic coverage. And this truly does address what the name of that stage is, which is, really a catastrophic need or a very, very expensive medication. John can attest to this. We all have worked with many, many clients who have extremely expensive medications. And it's heartbreaking to see someone in years past go into catastrophic coverage as early as January or February and know that they still had to pay 5%, which could still be a lot for the medication all the way through the rest of that calendar year. So this is a huge change that's going to be life-changing, honestly, for people who have medications that fall into that category of being very, very expensive. And a couple of other items to note, and all of these changes that I've referenced so far are tied back to the Inflation Reduction Act that addressed a number of portions of the Medicare Part D program. Another one that many of you may be familiar with is the cap on the covered insulin products. So those will be the insulins as identified by that plan on their formulary that are participating in this. You will have a $35 or less monthly supply. And then in 2025, what we are scheduled to see is an out-of-pocket maximum on Part D. So still in 2024, there's not really an out-of-pocket maximum per se. We've eliminated the cost sharing and catastrophic coverage. But in 2025, we're scheduled to see an absolute out-of-pocket maximum for the Medicare member of $2,000. Once again, that is something that, based on all of the clients that we've worked with and really getting to know their drug costs very well, this is going to impact a lot of people and potentially be life-changing for those with expensive medications. All right, so we're going to head into enrollment periods, but John, do you want to add anything, or Part D is always the place where everyone's eyes glaze over. So are you still awake?
Hey, yeah, I would just say that the estimate for next year is about $3,300 of out-of-pocket spending. Again, just to reiterate that now it's unlimited. And in 2 years, as you indicated, it would be $2,000, and that $2,000 would index much like IRMA and things that just index upward in the future, as to address for medical cost trends and things like that, as well as the prescription drug cap of 6% annually in premiums goes into effect starting next year. Well, technically in 2024 for 2025, but you cover it always well, so not much else.
Yes, thank you for adding that clarification. So it's not as though we can expect the future out-of-pocket limit of $2,000 to stay at $2,000 year after year. That was an important point.
Exactly. just like IRMA indexes, I mean, Part B costs and things don't necessarily have an index. Those just go up based on costs, but the others, there you go.
Yes, very good clarification. Thank you. All right. So, as I mentioned before we started talking about prescription drug coverage, it is very different. If your head hurts right now, that's normal. So please feel free to reach out and learn more, ask more specific questions to go over those details. So when do you enroll in Medicare? Well, we're going to talk about this in groups of what your circumstances are. So who are you? So first of all, we'll take a look at turning 65 and not covered by employer coverage. And that might be yours or your spouse's. So you could be covered by a spouse's employer coverage at 65. If you're not, we are going to be looking at you enrolling during what's called your initial enrollment period, or your IEP. And we'll look at what that time frame is on another slide. It is 3 months prior to your birth month, and then your birth month and 3 months after. And we'll show you a little graphic in just a second. Now, how do you enroll during your initial enrollment period if you're someone who needs to do this? So if you're receiving Social Security benefits of any kind, you will automatically be enrolled in Parts A and B. You'll receive the Medicare card in the mail. Now, if you're not receiving Social Security benefits, enrollments in Part A and B can be done by phone or online. Recently, the wait time for phone enrollment has gotten longer and longer. We really do not recommend that. We recommend online enrollment. And as you can see right there, that their bullet point says start early, and you'll want to, reach out to us if you want to add any of that additional coverage, or really just talk about your options that we mentioned on the earlier slides. We want to make sure that there's lots of time to assess everything and that there are no kind of deadlines that you're rushing towards. Late enrollment. So if you're someone who needs to enroll during your initial enrollment period because you don't have creditable employer coverage, late enrollment can cause delays in coverage and penalties. So it's not as though you can kind of miss that enrollment period and then just jump in when you remember. You're going to have to wait until a specific time of year in order to enroll, and then there may be associated penalties depending on how long that wait is. So it's something to really be on top of. Now, next circumstance is if you are turning 65 and you are covered by employer coverage, whether yours or your spouse's. Now, we want to make sure that that employer has more than 20 employees. And if so, that should be what is called creditable for Part B, so creditable coverage. Now, we do always say that you would need to confirm that with your employer and health plan. But what you have when you are going to be able to be on employer coverage past 65 with this large enough employer is you have the opportunity to postpone your Medicare enrollment as long as you are still covered by that employer coverage. You could switch to a different large enough employer during that time frame without a gap. You're going to be just fine as well. But then when you are later ready to enroll in Medicare, you'll have what's called a special enrollment period. And in your special enrollment period, we're going to want to walk you through a number of things. First of all, making sure actually prior to the special enrollment period, we want to make sure that you are if you are not contributing to an HSA, that you do enroll in just Part A. So remember that Part A is the part of Medicare that does not have a premium. And it's great to be enrolled in Part A while you're still covered by that employer group plan, as long as you're not contributing to an HSA. So you're not allowed to make HSA contributions and be enrolled in any part of Medicare. I know that there was a question in advance about this, Margie. We'll wait till the end and just get into it a little bit more, the specifics of HSA and Medicare. When you are ready to transition from your employer coverage to Medicare, you're basically saying, this is my special enrollment period. I'm ready to enroll in Medicare. We do recommend a minimum of 2 months prior to that retirement date or the end of employer coverage. keeping in mind things like Medicare always begins on the first day of a month, not in the middle of a month. And also keeping in mind that things happen, and sometimes that transition period can't be 2 months long. Sometimes it's a lot faster than that. So we have some tips and ways that we can help expedite the process if you fall into that situation and we need to move it along faster. So things to keep in mind, again, I mentioned that you want to confirm that that employer coverage is creditable for Medicare. And one of the things that we always get so upset to see is that often people will think that they can go from their employer plan onto COBRA, and that it is in some way the same status with Medicare, so that they're still covered by an employer plan. COBRA is not considered creditable coverage after age 65. So if you're leaving, if you're retiring, if you're leaving your employer and you're offered COBRA, you will still have to have Medicare A and B to begin when the employer coverage starts and before that COBRA coverage begins. It's a little bit more complicated than that, so please reach out to us, but you do not want to be over age 65 on COBRA coverage without A and B. It's a really bad situation to be in, so don't make that mistake. People who are under 65 and receiving Social Security disability insurance will have 2 different initial enrollment periods, actually. So they'll have IEP 1 and 2. The first one will happen when they are automatically enrolled in parts A and B upon their 24th month of SSDI. And then they will have a second IEP at the age of 65. And we've worked with a number of people who have gone through this, and it's wonderful to have a second IEP. New options open up to these Medicare members, and we have the ability to change plans into something that would be more suitable for that next stage of their life. So people who fall into this category, we want to make sure that they understand they have 2 different IEPs, and it's a great benefit to them. And we want to make sure that they understand everything that's involved in that. And it's mostly good for the Medicare member opportunity, really. So definitely contact us if you have questions about the differences between coverage for under Medicare for people who are under 65 versus over 65. There are some distinctions, and we can help you with that if that applies to you. So this is our slide to really put the initial enrollment period into a visual and understand how it works. So a lot of people will say, oh, my birthday is October 30th, so I can start enrolling in Medicare 3 months before that. You can actually start enrolling in Medicare as of July 1st, because your Medicare benefits are going to begin on October 1st. Even if your birthday was October 31st, they would still begin on October 1st. So you have the full 3 months before your full birth month to start enrolling in Medicare during your initial enrollment period. You do also have the 3 full months after your birth month, but your coverage will not begin until the first day of the next month, and that might cause some problems if you have previous coverage that is ending or should be ending. So you definitely want to make the use of those first 3 months, and really we always recommend the first month of eligibility. Let's get you enrolled so there's no stress through this whole process. And one quick note, a few people have first of the month birthdays. My husband does. When you have a birthday on the first of a month, you actually get 1 earlier month. So your whole progression moves back by a month. So in his example, October 1st birthday, he gets his initial enrollment period starting on June 1st. All right, so why does all of this matter? Well, you may have heard about some of the penalties that are associated with late enrollment in Medicare, and they don't always match. They don't look the same. They don't work the same way. We can explain these if you have questions about these and want to talk to us about them in more detail. But just generally speaking, Part B, late enrollment penalty, if you don't sign up either when you're supposed to in your initial enrollment period, or if you have employer coverage later on during a special enrollment period, you can have a 10% penalty for every full 12-month period that you don't have Part B. And then that adds up. So if it's multiple 12-month periods, you'll have 10, 20, 30, and so on. And then you're also looking at, as I said, potentially a delay in coverage, because we can't just sign up any month of the year. You have to wait until the general enrollment period at the start of a new year. Enrolling in a Medicare supplement, I mentioned this earlier, and I'll just touch upon it again here. The first 6 months of enrollment in Part B is what is called the Medicare supplement open enrollment for that Medicare member. So it's specific to your Part B start date. And enrolling in a Medicare supplement outside of that time period may involve the risk of being declined for health concerns. Enrolling in Part C, remember that's Medicare Advantage, and then Part D, a standalone prescription drug plan perhaps, that needs to be done during your initial enrollment period or within 63 days, essentially 2 months of your special enrollment period start date, which could be that example of working past 65. Now, that's late, right? So who really wants to have a 2-month gap in coverage? The way we like to do things is to make sure that everything lines up and that you don't have those gaps in coverage or even overlap. So we want to see one new plan begin when your old one is ending. And this is just an example of, if you do wind up having a gap, what your kind of grace period is. You have 63 days before you're going to be late enrolling in Part C or Part D and potentially having to wait for a new enrollment period. That's probably the biggest concern there. And then, of course, Part D has a completely different type of penalty, but theirs is calculated at 1% per month that you did not have Part D coverage or creditable coverage. Employer coverage would typically be creditable coverage, plus delays in coverage as well. So I told you it was all a little different, but if you have questions, please let us know if you think any of these apply to you, or if you're concerned that they would. We'd like to walk you through it. So in terms of costs, some of the costs to consider under Medicare. We mentioned that typically Part A has no premium, but that if you are not eligible for premium-free Part A, you can purchase it for a premium that is dependent on whether or not you have any credits in your work history. Part B, we talked about the base premium, currently $164.90. And then we showed you some of the deductibles, the co-pays, the co-insurance associated with Parts A and B. And we mentioned that there is no annual or lifetime maximum on the Medicare members' cost sharing amount. Hence the goal to address that with one of those two coverage options that we talked about. Other potential expenses, things you'll want to be thinking about, are that Medigap plans do have monthly premiums. We mentioned that those were tied to where you live, sometimes age and gender. And again, those can be state specific. So just have to speak really in generalizations there, and it will depend on where you live, which of those parameters are used to set the monthly premiums for the Medigap plans. Part C or Medicare Advantage plans may have a monthly premium. There may be a premium for, or typically for a standalone Part D plan, there will be a monthly premium. And there may be a deductible. There are usually co-pays and co-insurance for the higher, for most tiers. Sometimes you'll see, a lower tier medication with a low or no co-pay. Some things that you want to think about if you opt for original Medicare and a Medicare supplement. Remember that A and B cover what A and B cover, and the supplement can only help with things that A and B covers. So because dental and basic vision and hearing are not included with A and B, those are things that you can either pay out of pocket to address or add additional individual plans to your other coverage. IRMA. So we haven't talked about IRMA yet, and this is impacting more and more people each year. So IRMA, these are the income-related monthly adjustment amounts. And what we have right now, we've shown you some 2024 numbers, but we don't have those yet for IRMA. So we are looking at the amounts for 2023. And what you see on the screen is a chart that shows the ranges of income. Now you'll notice that's the second column that we're looking at, and Social Security is going to look at your tax return from 2 calendar years back, so 2021 in 2023. And that's something that adjusts every year. At the start of 2024, they're going to use 2022. And what happens here is that people who have higher incomes will pay more for Part B, and they'll also pay a surcharge on Part D, and you'll see that in the 5th column. Now, there are life-changing events, and the most common one is certainly retirement, that allow you to address these amounts with Social Security. So you'll work through an appeal form, present that to Social Security, making an estimate of typically your current year and the next year's income to explain that income, it looks different now than it did 2 years ago. You'd like them to look at your current income to make your Medicare premiums match more closely to your reality. So this is something that we talk to a lot of clients about. People usually have questions about this, so certainly feel free to reach out. But if you are not enrolled in Medicare yet and you're here today because that's getting closer, this is something that you might not yet know about, and certainly something that you should be aware of in these years leading up to Medicare, so that you can be planning and talking to the experts, Margie and her team, and really being prepared for this side of Medicare. In 2020, about 5% of Medicare members were paying these income-related monthly adjustment amounts, or IRMA charges. Now we're at about 8% of Medicare members who fall into these additional amounts on the screen. So who can help with Medicare? Because I promise it's still confusing even after being on here for almost an hour. So on our website, so we are, and we're in the process literally yesterday, today, tomorrow, of a name change. So we have gone from Medicare Portal to MP Group, mpgroup.org. On our website, you can find resources, checklists for your different enrollment periods, IEP, or if you're going to have a special election period working past 65, some of the forms that you may need for the process. We have videos that we have done to talk about some of the specific topics that we've just touched on today. You can find a video that might go into more detail on something that you want to learn more about on our website. We do have a quarterly newsletter, and you can see we're on a lot of social media, but also you have resources with Social Security, ssa.gov. Again, your enrollment into Medicare is through Social Security, so you'll want to make sure you have a profile on the ssa.gov account, a way to log in, and then once you're enrolled in Medicare, you're going to find the Medicare.gov site especially helpful. And we love to show people all of the things that you can do there and all the things you can see. Even prior to enrolling in Medicare, I did mention you can look at your current doctors and see who is participating in Medicare very easily on that site. Medicare also has an app that you can put on phones and tablets, and it is run by Medicare.gov. And in that app, you can plug in a service or treatment or some kind of medical need and determine how Medicare covers it, if Medicare covers it. So that's something that can be handy to have on your phone, especially if you have transitioned onto Medicare and you are going to doctor's appointments and you want to have that pulled up as you're talking to a doctor, maybe discussing a potential service or treatment. You can use that app to get more information and ask your doctor more questions right there on the spot. So, John, what have I forgotten about resources and who can help with Medicare?
Nope, you've covered it all.
Okay, all right. So as I mentioned, this is kind of a really, it was a little bit unexpected to us. We've been Medicare portal since John started the company, but due to a new Medicare rule, we have to pull the word Medicare out. We are MP group, but nothing else is changing. We still navigate Medicare together. So, all right, so I wanted to make sure that we addressed each of the questions that were sent in, but then Margie, did you want to discuss the HSA question and make sure, let's do that one first to make sure that we fully answered that, because it is tricky.
Okay, so I take copious notes always and once again. So thank you so much, Emily. And for the attendees who know us, Blue Heron Financial Group, I think that you understand why we've called in the experts. We get a lot of questions about Medicare, some which we can handle, but more in line with how will my Medicare payment be affected by things that we're doing on the investment front, distribution front, and they're so intertwined. So I'm delighted to be able to connect you all with MP Group and with Emily and John, and we're just delighted. We're not affiliated with one another, but boy, do we have some overlaps in our desire to help our clients through just a myriad of all kinds of financial and otherwise questions. So we did have a few questions that were sent in prior to today's presentation, many of which Emily addressed, but I just want to circle back to one because it does affect a lot of the folks we work with Northrop Grumman who are on HSA. They're making those contributions, they're looking to retire, and they understand that there can be a penalty and that they have to stop contributing 6 months before starting Medicare. So one question was, is it 6 months before the first month of receiving Medicare, or is it 6 months before you turn 65? What's that HSA stop point? So that's one question.
Do you want to answer that, John, or do you want me to?
Yeah, it's just simple. Medicare eligibility for most starts at 65. So you can't, in a sense, retroactive to 64 and a half because you weren't on Medicare. The key thing to understand with Medicare is Part A. If you're on an HSA, you would delay that because the employer insurance would remain primary. Part A you wouldn't want to get it because it would create that tax code violation. But what you need to be cognizant of is that when you do apply after 65, that Part A, it's non-negotiable, is backdated 6 months. So hypothetically, if I turned in an application today for a Part A and I'm 66 or 67 years old, they would probably retro my start date back to April 1st. So what that does is any contributions made from April through today would be negated. And also, if you overfunded your HSAs in the months of, say, January, February, and March, that you would have to, in a sense, back those out, reverse them or something, because it's a prorated. HSA is calculated at 1/12. So hypothetically, if you just put $300 a month, you're on pace. But if you were to put $600 a month in those first 3 months, you're funding, in a sense, 6 months, although you were on Medicare for 3 of those months overlapping. So you don't want to make any contributions into those months as well as exceed the limit of any 1 month contribution.
Great. Or I'm sure you will get a friendly letter from.
Yeah. And the thing there, Margie, is you get penalties, interest, and then excess penalties as well. Now, again, you want to do your best to avoid it. And what we always tell people is if you know when you're going to retire, so hypothetically someone says, I'm going to retire, July of next year, I would basically tell them you can't fund next year because July would wipe out all the way back through January. So just don't fund the entire, it is what it is,
Yeah, and I appreciate that clarity on it. And again, I'm glad that we still have Emily contact information up here for any of these questions. I want to be sensitive to everybody's time who has joined us today. We will always be a resource for you. However we can help, you have our contact information there to contact Debbie in our office here at Blue Heron. We are grateful again for our long-term working relationship with Northrop Grumman employees, helping them to prepare for their retirement and working with them throughout retirement, and to bring this incredible resource of Medicare professionals to you to reach out to, or if you can't find their contact information, certainly let us know and we'll connect. So without further ado, everybody have a wonderful day. Thank you again, Emily, for your willingness to jump on with us. John, congrats for just being so mindful of the needs of the folks who are approaching that magic 65. Good job.
Thank you so much for having us.
For having us.
We'll do it again, I hope. Okay. Have
Sounds
a great
good.
day.
Take
Bye.
care.